Hi, my name is Michele Savin. I'm a neonatal nurse practitioner, and along with my partner Heather Baker, we want to explain to you about a holistic nursing approach to the education of vulnerable substance-exposed mothers to help with care of their infants. At the conclusion of this presentation, we hope you, the learner, will be able to describe this novel approach, which is a wraparound to the care of substance-exposed mother-infant dyad. We don't have anything to disclose, and without further ado, we want to tell you about our program. So, New Expectations is this novel approach. These women are facing incarceration and instead can be sentenced to a community-based inpatient program where they can get counseling and medication-assisted treatment to help their struggle with substance use. This group home approach, if you meet the criteria as a pregnant woman who is using drugs and has been involved with the correction system, you can get enrolled, and it is an alternative to incarceration where women can stay when they're pregnant, they can get abuse help, they can get education, and most importantly, they can stay with their babies. This program can house 17 women and their babies at one particular time, and is a wonderful way to keep women and babies together and to keep women out of the prison system. The March of Dimes and the Delaware Healthy Mother and Infant Consortium became involved because we wanted to leverage connections in the community and act as a liaison to help bridge gaps in services for these women. So what we do as nurses is we meet with the women on a weekly basis to offer a series of topics. These topics are based on the needs of the women in the house, and we're able to leverage expert community resources and pull them in and include them as is desired by the women and as is needed by the assessment of what the women in the particular program are looking to achieve or where their gaps lie. Excitingly, when we first started this programming, we put together a program to include all of the topics listed here. And we go out weekly, we talk about reproductive life planning over the span of a few weeks. We work with the DE Thrives website and the reproductive life planning program that was created through the Delaware Healthy and Mother Infant Consortium. We talk to them about safe sleep education, focusing on what we know our statistics in Delaware are, but also focusing on, of course, the recommendations of the AAP about safe sleep. We discuss abusive head trauma education. We enroll women, and actually all but one of the women who have gone through the program have been enrolled in home visiting, which we know is a great evidence-based program, and that home visiting continues after their discharge from the program. We certainly work on smoking cessation, which is important for moms and babies and their wellness. We talk to moms about postpartum depression and emotional wellness, and we educate them about healthy relationships and ways to work through communication skills and improve their lives on many levels. However, after we started all of this programming, the staff at New Expectations and the moms there themselves came to us and said, you know what, we have greater needs and we want more resources. And it's just terrific that we can provide these women who would otherwise be incarcerated with these terrific wraparound services. And so they asked, and we brought in normal growth and development, infant feeding, certainly education about neonatal abstinence syndrome, how the babies are scored, how the babies are treated, and lots of support with non-pharmacologic interventions. We talked to the women about newborn emergencies, OB emergencies, breastfeeding support. The food bank comes in and gives cooking classes to the women and helps them make good, healthy choices. We have a budgeting program that we've been able to bring in that all the women who go through this program have been exposed to. And then, of course, sadly, some of our babies will get delivered and have to go to the NICU. Some of them will need some medication-assisted treatment to get through their neonatal abstinence syndrome after their moms have been exposed to these drugs. And so we show the women, we get them prepared, we take them through labor and delivery, and we show them our continuous care unit where they can stay with their babies after the babies are delivered if the baby requires hospitalization. Interestingly, they also wanted and were interested in prenatal and postnatal yoga, and we were able to bring that support in. Since inception of our intervention programming, February 2015, about the last 18 months, 31 women have come through New Expectations. 15 of those have been on methadone and 1 on Subutex. Some of them have not been on medications because for various reasons, by the time they were enrolled, they weren't using substances anymore, and that's wonderful. 6 are currently in the home. 16 have successfully completed, and unfortunately, there is a recidivism that happens. 9 have unsuccessfully completed the program and or returned to incarceration. As I said, 30 of 31 have accepted participation in evidence-based home visiting, and we always are evaluating and readjusting and evaluating as we go forward. So what we would like you to understand about this is that there are ways to do wraparound services for women who are at risk. It's always better to keep moms and babies together. It's always better to offer the moms as much education as they're willing to receive from you, to talk to women, to lower your expectations, and to just go in and listen. And you as nurses can provide all sorts of support that these women are lacking and are desperately in need of. So go out there, use your expertise, and you can make a difference in the lives of moms and babies who are exposed to the correction system, who are exposed to prenatal opioid use and addictive behaviors, and use your nursing knowledge and jump in there and do good for moms and babies. We want to acknowledge the March of Dimes, the Consortium, our Delaware Perinatal Cooperative, and Christiana Care Health Services Hospital and Thomas Jefferson College of Nursing for their support of this program. And so Heather and I thank you, and good luck.